It is a great Tuesday afternoon. It's sunny down here in Delaware. So welcome, and I hope you're all doing well and staying safe. We are at CSC Station, and I can't believe it. This is our third meetup, and I'm really excited for today. I wish we were all down at the station with pizza and beer, but that's okay. It'll still be a great afternoon with Veronica, and thank you so much for joining us. It's been 90 days since the lab was stood up, coming up on our 100th day, and we've had some great milestones. One of the most important was we were able to present to the African American Task Force of the General Assembly last Thursday. Our fellow Hector and our technical lead Ryan did some great work down there. You'll be able to see the YouTube video through any of our blogs or our website and any link there. And so that's really important work that's being done already by the lab in really 3 short months. And then Friday, if you check out the blog, you'll be able to watch 2 other fellows present the work that we've done on FAFSA and the declining rates of FAFSA during the COVID and what that can look like and how we need to remediate that going into 2021 for our high school seniors. So without further ado, none of us would be here without the amazing sponsorship and our founding member, Compass Red, and I will turn you over to Patrick Callahan.
Thank you, Anne, and thank you to all the fellows who are working hard at this. Actually, I just saw Matt Meyer, our county executive, is on as well, and a special thanks to Matt and his whole team at the county, because without they're taking a risk on us through the CARES Act, we wouldn't be here. So special thanks to him and his team. So just Compass Red, we're a sponsor of these meetups. We have been for 3 years now. Why we do these things is to build community, to bring out the data scientists in the region, to share ideas, to network, and to help hopefully spark some of that innovation from the perch we sit here in Wilmington, Delaware, that covers the Philadelphia region. I'd like to thanks to the different organizations like Data Philly and so many other important groups in our region. And we also have people calling in from California, from Texas, and from DC as I look through the meetup signups. As Anne mentioned, we've had a couple meetups so far. The first one was just to focus on the Data Innovation Lab and what we're doing. The second one was with Beth Flower as she presented her COVID dashboard. I'll tell you a little bit about today's in just a second, but we have a few others. Every month we're doing this. So next month will be AR and VR, virtual reality, and how data affects that. The following month will be on climate change and how data is supporting that. And so if you have ideas of other meetups that you think that we need to have, please pass them on to the Data Lab. The website is www.ddil.ai if you need more information on that. So to get on with the main talk of this, I'm really excited to be able to introduce Veronica Vanderpool today. As you know, because we're all from major cities here, at the heart of every major city is a successful metropolitan or every metropolitan around the world, there's the veins that actually feed it. And transportation is part of the life and growth of a big city. One could argue without that efficient transport system, there is no successful city. It's important, it's relevant, and it's required. And so today, we're excited to, and we're fortunate to have Delaware Chief Innovation Officer for Delaware Transit Corporation. She was recruited in 2019 down from New York City, where she sat on the board for the largest MTA in the world, New York City. I think it's the largest. So she sat on the board for that, and she's been involved in so many other organizations that feed that. And she serves at the intersection of transportation, equity, and community development. And if you think about those 3 things, it's the pillars that any good MTA will actually stand on. She's going to discuss her role, the impact of COVID on transportation, and some of her initiatives and her needs and intersections with data. When I first met her, I was like, holy cow, how did we get you to Delaware? And she said it was easy. She could have a big impact here in this region. And then I don't just say Delaware, I say the Philadelphia region. So Veronica, I'll hand it over to you, and thank you again so much for making the time to speak with us.
Thank you very much, Patrick. It was actually in November that you and I first connected and had a great conversation where we completely nerded out on data and how much we love data. So I knew that it was a good match for us. And I appreciate you, Devin and Anne, welcoming me to discuss data in transit. Data in transit, I appreciate you giving a platform to me to talk about transit and the importance in Delaware. And as we go through the slides, I think it's particularly important to impress why transit is so important in the state. So I am going to go ahead and share my screen. And I think you can all see it now. Thanks for the heads up. So I am new to Delaware. As Patrick noted, I have come from New York. I actually just moved to Delaware in June, so I'm here just a few months. I've only lived in New York my entire life, and I grew up in the Bronx. So if you're picking up an accent, it's a Bronx Puerto Rican accent for those of you who are familiar with dialects and communities throughout New York City's 5 boroughs. What interested me about coming to Delaware and working in this new Office of Innovation was the opportunity to shape something new. But it was also a challenge because I was coming from a region that is so heavily transit dependent. For example, when you think about the New York MTA, Metropolitan Transportation Authority, it is indeed the largest transportation network in the country. And pre-COVID was serving 8.5 million passengers a day. We're talking about a workforce of 72,000. We're talking about an annual budget, operating budget of $16 billion. So we're dealing with volumes that are significantly greater than the next largest transit systems. So I've arrived in Delaware in a very different context, a very different geography, but a lot of challenges, and I was really intrigued by that. One key challenge is transit is not part of everyone's day-to-day here. In the state of Delaware, 81% of residents use their personal car alone to get to and from work, and only 2.6% of people are using transit to get around. And you compare that with other large cities, New York, Chicago, Boston, Philadelphia, LA, San Francisco, and we know that transit ridership is significantly higher. But then you look at Minneapolis and you look at other cities in the Midwest and you see how they have put significant resources into building out their transit systems. And in these cities, transit is the lifeblood of these cities. And transit is a lifeline for people who depend on it the most. And that's something that I always hope comes across when we're talking about transit and the importance of transit. So I want to just start with a little context, a little bit of additional background. I've been working in the transportation sector for about 15 years. My background is actually in environmental science and policy, so there's a natural intersection and nexus there. I enjoy transportation because it touches everyone's lives. Even if you're not someone who will ever ride a bus or a subway or commuter rail, you should be thankful that a transit system exists in your community, because that means one fewer person in a vehicle, adding additional congestion to the roads and adding wear and tear to our infrastructure. So it's important for all of us to think how important transit is, whether we're users of the system or not. So I want to talk a little bit about Delaware ridership before and during, just to give you a context, some balance on our discussion today. So the yellow line is actually our ridership on DART First State Service, which is provided by Delaware Transit Corporation. Delaware Transit Corporation is a subsidiary of the State Department of Transportation. And the blue line is the national average. So actually our ridership was doing significantly better during the pandemic over the past year or so than the accumulation of transit systems across the US. That could be because we only operate one mode, which is bus, while we do have 4 rail stations in northern Delaware in Newcastle County. We contract with SEPTA to provide that rail service. Delaware Transit Corporation only provides fixed route bus service and paratransit service. So we might see some of the impact of just providing this one mode of service means that we've done fairly well. But I think that this tells a different story. I think that this is actually a reflection of the dependency of our riders on our service. This is a population of individuals who really have no other way to get around but to rely on our service. And when you think again about the percentages of people who are driving alone, again, 81% in Delaware, and the percentage of people who are using transit statewide, that's 2.6%. And then you think of many of those individuals who are using transit actually fall below the poverty line. And when you look at our ridership, about 2/3 of our riders make $30,000 or less in a household. So we see a significant amount of overlap, particularly when you drill down and you look at a big city such as Wilmington, where the biggest transit ridership occurs in the city of Wilmington, and that's at 12% of residents are using transit to get around. But then you start looking at other statistics and you start to learn that in Wilmington has the highest percentage of households without access to a vehicle, and that's 22%. And then you overlay that with what the poverty rate is in Wilmington, and that's 27%. So you start to see that there's not much elasticity in terms of transit ridership if you drill down and you look at, again, who's most dependent on our transit services. And when I talk about transit being a lifeline, it may not be a lifeblood in the economy of the state of Delaware, but it is certainly a lifeline for those individuals who rely and depend on the service that we provide. This just provides a more specific snapshot of our ridership. So on the top left quadrant, you'll see our statewide ridership, a precipitous decline between February and March, not unlike any transit system around the world or many other services around the world, in fact. The top, or rather the bottom left quadrant, is the ridership on our paratransit vehicles. And many of you may be familiar with these much smaller buses, mini buses through the community. Delaware is particularly unique because we offer paratransit service to individuals 65 and above, and to individuals living with a disability that qualify for that service. So not unlike paratransit services around the country, we've seen a very sharp decline because these are often individuals who are immunocompromised. And a lot of the facilities that they were traveling to, such as senior centers, had closed during the pandemic. And many of these individuals were just limiting their travel given their immunocompromised state. So they weren't exposing themselves. They may not have been leaving the house as often. And then on the right, we'll see SEPTA rail ridership. Commuter rail systems around the country have seen significant drops. SEPTA saw about an 81% decline. It's not unlike New York's MTA, which was seeing 90 to 95% decline on Metro North and Long Island Railroad, if you're familiar with those rail systems. And what this also shares in terms of a story is many of the commuters that were coming into cities such as Wilmington were no longer coming in on commuter rail. So we saw a sharp decline in those individuals using our services, such as a bus route from the Wilmington Transit Center or from the Amtrak station after having gotten off of SEPTA, and using our buses to get further throughout the city of Wilmington and beyond. So we saw a sharp drop in those commuters and that constituency. But it made us think differently about the service that we were providing and who we were serving. We no longer had that white collar constituency that was coming into the law offices and the financial firms and the fintech industry. Instead, we had the core base of our ridership, and we got to see how we were addressing and meeting their commuting patterns and travel needs. Data plays a huge role in every transit agency, and it's no different in Delaware Transit Corporation. So there's three big sources of data that support the operations that we run every single day. One of them is the GTFS, and it is basically a standardization of data reporting so that third-party providers such as Transit or Move It, if you're familiar with those apps on your smartphone, they're aggregating data from the GTFS feed. And it assists with schedules, it assists with fares, it assists with geographic information systems, just so we know where the buses are and where they're located. It provides real-time information such as arrival predictions and vehicle positions and service advisories. So this is something that we rely on, and it's part of open data. And it's incredibly important for, I think, transit agencies and other entities, such as ride-sharing companies, to provide this data in an open data format, because we get to build on the intellectual capital of the public at large and data scientists such as you all to help refine and modify and improve the service by looking at our data very closely. We don't have a monopoly on doing things right and well all the time. And any transit agency should be able to say the same thing. So we rely on the expertise and the knowledge of others in the community to help us improve the service that we're providing. Another data source is APC, and this is essentially counting the passengers that are coming on and leaving our bus at any given time. And this really provides stop specificity, stop level specificity, route specificity, so we can understand what are our most traveled routes throughout our state on our bus network. Where are there opportunities to improve on-time performance? Are buses arriving to their locations at the specified time? This really helps us understand who is using our system. And because ridership is such a key measure of success for all transit agencies, it's particularly important for us to understand how many people we are transporting on a day-to-day basis, and not just on a daily basis, but on an hourly basis, and also looking at the days of the week and whether or not we need to enhance service on the weekend, for example, or add service later or earlier into the day. And we've relied on data from our APC in order to provide that. It helps us evaluate our schedules, which we're often doing, as many transit agencies do. It helps us decide where we should put bus stops, just based on the ridership information. Do we have a stop that's being only utilized by one passenger a year? Should we be reevaluating the existence of that particular stop, or looking at the routes that serve that stop? And it's incredibly important as we think about enhancing our service and adding service frequency and closing the gaps in service schedules. So instead of waiting 20 minutes for a bus, maybe you're waiting 10 minutes for a bus. We make those decisions based on data that we get from the APC. And then lastly, the sort of third big batch of data, one of our biggest data sources is CAD AVL. And this collects real-time location data. It's telling us if our buses are running early, if they're running late, what the distance traveled is, because we're able to do time checks on our buses on the routes. It's helping us understand if our operators are stopping at the correct points throughout their routes. It helps us provide better service to the customers we serve. So if you are a DART First State Transit user and you have the DART Transit app on your smartphone, you are able to follow your bus, its arrival in real time. So you can sort of click and know that the time that's being displayed is when you should expect to see the bus at that particular stop. And that helps us as transit users in terms of convenience, reliability, and planning our trip. It also assists dispatchers and supervisors by giving them a clear picture of what's happening on the road. So they know what vehicles are out there. They know if there's a situation that they need to avoid, such as a detour or an emergency situation that they must avoid. So it provides all this comprehensive real-time information that allows so many different players on the back end to make real-time decisions that impact our riders' travel experience in any given minute. And then our operators, because of our CAD AVL system, also have a mobile data terminal, and they're able to stay connected to real time and real data information as well. So what's the data we need? We always need data, but what kind of data do we need? Well, we need to better understand our corridors of connectivity. So our transportation network is certainly more than roads and highways, but it's hard to tell that when you're in a car-dependent community or a car-dependent state, such as Delaware is. So how can we create bicycle, walking, transit corridors? What is the connectivity level that we might be striving for? What are the nodes of activities? What are the connection points between health facilities and educational campuses and recreational activities? How do we link that all up in a corridor of connectivity? So we need to better understand, and that leads to sort of another data set we need, which is understanding our geospatial data sets. We need to understand the intersection between zoning and land use and the infrastructure that exists to support our transit stops. So if we have a bus stop, and we've all seen them, and DTC / Start First Aid is as guilty as any other transit station. We see these bus stops that are in the middle of nowhere, and they're very difficult to access. So it's something that we as a transit agency are looking and assessing to see, well, how do we improve accessibility, the infrastructure, the land use design around the areas that we best serve and around our bus stops. So we need better partnership with so many other divisions and organizations and agencies throughout the state of Delaware. And some of that coordination exists, but there's always room for improvement. So we certainly need to do more info sharing across division and agencies to strengthen and bolster the data sets that we have. And then lastly, we always need better demographic data. In November 2019, Delaware Transit Corporation did do a survey of our riders, but it was only a snapshot of 14% of our ridership. And we certainly want to understand how people are traveling, why they're traveling that way. What is their age? Would they take many more trips if there were other modes that they could connect to, such as bike share or car share? And this is the information that we don't necessarily get just due to capacity constraints, time constraints. People want to just get on the bus. They don't necessarily want to answer a survey. So we're looking for ways of engaging with the public in a myriad of ways to better understand that demographic data. So what's been the effect of COVID on transportation? So what we've been doing during the past year is changing our service, changing our practice, and changing minds. So changing service, I touched upon this a little bit when I was referencing the constituency and the demographics of our customer base traveling from Philadelphia, for example, into Wilmington, and how we saw such a precipitous drop in that particular ridership base. And it made us think about how we are serving our core base of residents and transit-dependent individuals, not just the commuters, the people who are using our service, not just for work, but getting to essential needs and services. And we actually just implemented a fare and service change in mid-February, where we've been looking at all the data that I shared with you, all these different sources, and analyzing how do we provide better service for the people who need it the most. And COVID has allowed us to do that with a tremendous amount of clarity. And many transit agencies have also benefited from being able to see who's most reliant and how they may be able to adapt and modify and adjust their service in order to meet the changing and emergent mobility needs of the core ridership base. Changing practice. So this is as pragmatic as upping the frequency with which we clean our buses. We also actually were just successful in winning a second federal grant to test barriers for operators in the indoor bus environment. Does that give and increase a semblance of additional security and confidence to both our employees and our customers if we have barriers of different model types and different thicknesses and different materials, and understanding the role of barriers on long distance trips? Because many of you might be aware that we have inter-county routes that traverse the state. So we've been thinking innovatively about how do we change what we're currently doing, and we're looking into different ways of exploring the impact of certain decisions, again, like implementing some of these barriers. And then, engaging with the public, that has had to change significantly. That's one key way we're changing our practice. We used to do a lot of in-person public hearings or community conversations, and we've not been able to do that, but the public needs to be apprised of all the changes that we're doing. So we've had to adapt to virtual tools. And there's a lot of considerations there. How do you ensure that you're not cutting out the people that we need to hear from the most that don't have access to these virtual tools? So, there's tremendous balance and considerations that go into changing practices. It's not just trying something new. It's making sure that what you're doing is most adaptable to as many people as possible. And then lastly, on the changing minds, this COVID has been a very powerful reminder in a state with such low transit ridership, such as Delaware, why transit is essential. Because of the service that we've provided, people have been able to get to grocery stores, both employers and those of us who need food for our families. It's allowed restaurant workers to get to work and allowed us to support those restaurants with takeout dining. It's allowed people to get, of course, to medical facilities and services, et cetera, in ways they may not have been able to access before. So transit, not just in Delaware, but across this country, has really been underscored as essential. And in fact, it's one of the reasons why the federal government has switched course and provided operating support for transit agencies, which is generally not something the federal government has done, particularly for large cities. They've often supported very generously on the capital side of transit agencies, but Delaware Transit Corporation was one of many beneficiaries of federal operating support from CARES funding, for example, that continued to support our cleaning practices and making sure that we didn't have to institute any layoffs. So as we wind down, I really wanted us to start thinking about the nexus and the intersection between the impacts of COVID and land use and housing and outdoor space and transit ridership. There's been so much written about, will cities die because of density? Is this the death of cities around the world? As people started to fear density, and density became a bad word. And actually, with all this fear about density, I think some of the more dense communities actually fared very well, because it shows that it made it easier for people to stay connected with neighbors and families and friends while they were sheltering in place. So it's really interesting to see what implications that has as people start thinking about moving out of more sparse communities into a mixed use living environment. It also speaks to opportunities for other modes of mobility. So what does this mean for bike lanes and micro mobility, such as e-scooters and bike share and other ways that people are getting around? People are desiring more of that. In fact, it was very difficult. If you don't own a bike during the pandemic, you're pretty much screwed, because it was very difficult for you to obtain a bike. You ask any local nonprofit, any bike share store, and they will tell you that they had wait lists of dozens of people waiting to get a bike. So biking was on the increase. People wanted another way of getting around and started to appreciate either the infrastructure they had in their community, or started to lament the lack of that safe infrastructure. Well, people want mixed use development. There was a trend toward that. Well, people want to live in a community that provides better access to restaurants and leisure activities and employment opportunities and different housing types, such as two-family or two-bedroom units, for example, instead of the single-family home. So there's some real implications for what people may be thinking out as many have experienced a sense of isolation during the pandemic and have wanted increased and greater access to some of these other resources. Will there be more parkland and open space? As all of us felt so confined in our homes, many of us were yearning for access, and some of us were lucky to have it, many others were not. Many others did not have the benefit of going out and walking on a trail nearby or going to their local community park. So it really put a spotlight on what it is that we want to see in our communities and what we might be gravitating towards. And I want to share this very valuable survey that was done by the Delaware Valley Smart Growth Alliance. And they did this survey in May of 2020. And at that time, they asked, 1 year after an effective vaccine, how will you value any of these characteristics? So we're essentially in that period right now. So, let's just hop along to February of 2022 or January of 2022 and start thinking what we might be thinking differently about in our communities just because we've just survived this pandemic. And what's interesting is that More than 2/3 of respondents want closer proximity to parks and trails. No surprise, all of us have probably felt a similar sentiment. Almost 2/3 of people want bike lanes. They want sidewalks. They want communities that balance the mobility needs of all users. And that's that concept complete streets that you'll see referenced there. People want communities that provide options for safe mobility. And we know that that is not necessarily in a vehicle. It is through other modes of transportation, and the better balance that we provide in our community, the safer we have, and the more desirable it is. And we're seeing some of those results come out as people start to look at this a little bit more closely. More than half of people still want to walk to their local restaurants and services, and it reinforces the importance in investing in different kind of infrastructure like sidewalks to better connect people with the amenities and the services that they like in their communities. And it's interesting when you look toward the bottom at the lower residential density, suburban, exurban living line, it stays the same. So all this fear about density didn't actually play out. More people are still okay with a lot of the changes that they've seen, but they want different options. And I think that's what comes out as we're starting to see a lot of the survey results from all these different academic institutions, and data scientists are looking at trends and such. So these are some notable survey results. Again, just a microcosm, but I don't think it will be a unique survey response based on what other communities are saying. And I just want to sort of add with, leave with these questions for consideration. And, you know, as we're thinking about the impact of COVID on land use and transportation, I'm curious. I want to know, where are people going to want to live? Are they going to prioritize access to transit differently in the state of Delaware? Might they be wanting to live closer to a transit hub or closer to the rail service that we contract with SEPTA? Are we going to see transit ridership rebound? Are we going to see people flee for the car? Are we going to see more investment in infrastructure, more funding going toward walking and biking and building a physically separated and protected bike lanes so people can travel on these corridors of connectivity throughout the state and connect to a bus route or connect to a bike share program that might be a hub at one of our transit facilities? Will people's preferences for working at home and having access to restaurants and medical services and their local pharmacy and drugstore, is that going to spur change in local zoning? We know that zoning is often an impediment to many different land use changes and housing type changes. Will communities start thinking differently about the benefits of some of this clustered amenities and thinking differently about how they can reform their land use and their zoning codes to better support this? Understanding, what are the new trends? Are people just going to work and gravitate toward employer centers where there's so many more different people working together, right? That was a trend. And in fact, Compass Red's office is an example of that. It's so many different entities and organizations working in one building. Will people continue to gravitate toward that? There's a lot of appeal to that. Or will people just want to continue working from home? So these are some of the questions that I'm thinking about, data that I'm hoping to see over the next several months, and hoping that all of you will think about and help secure and collect and analyze some of the data so we can have a more full picture on how COVID and any pandemic might be shaping the way that we engage in our communities, the way we work together and live together, and what we desire. What are the amenities and the priorities that rise to the surface as we're thinking about all the ways that we've been impacted, all the ways that we've been limited, but all the opportunities that arise from our very challenging year under COVID. So with that, I will ends, and I want to thank you all for your attention and your time. Like I said, transit is not something that often takes center stage in Delaware, but I appreciate those of you who do care, those of you as legislators or elected officials who have supported transit. And we want to continue to receive that support and expand it so we can continue to respond to those who need it the most and make sure that we continue to be a lifeline for those that depend on our service. Thank you.
Well, thank you, Veronica. Really appreciate, again, you being with us and for the very informative talk. We do have some time left over for some Q&A, and I saw a few questions come in through the chat, so would love to ask you a few if that's okay with you.
I'd love it. Thank you.
And then just for everyone else in the audience, if you do have any questions, feel free to throw them in the chat. We'll try to get to as many as possible, time willing. So first question, so you discussed like the many declines and the drops in ridership due to COVID. You also posed the question of what are the new trends? What do you think is a positive impact, if any at all, that this pandemic has brought into the transportation system?
Being able to really look at our system and the service that we provide with more clarity. So better understanding how our core ridership is traveling around the state. Maybe they don't need the bus that is making the circuitous route. Maybe what they need is something that's more direct. So it's allowed us to be more laser focused on the needs of our existing riders in a way that we may not have been able to do in serving a much bigger population, particularly those people who are commuting in and out and not necessarily residents of the city. And while it's important to provide transit service for visitors, for employees, for residents, I think many transit agencies, particularly in smaller communities, can very easily lose focus of some of our core residents and core ridership base. So this was important for us to reanalyze and rethink the service so we can better align what we have on the streets with the new demand.
Great. Recent one that just came through was from Zane Murphy. He asked, can you give an example of a time that your research influenced public policy, and how did you turn this from an idea into an action? Putting you on the spot, Veronica.
No, that's fantastic. I like it. So I'll give two examples, one from New York City and one from Delaware. So in New York City recently passed the congestion pricing proposal that has not yet been put in place. Essentially what it is assigning a fee to those individuals who are driving into Manhattan Central Business District, which is the most congested part of the city. And using that funding to support public transportation, New York's MTA. And research and data helped sway and shift the public perception that this was an unfair, regressive tax on the working poor and lower income individuals, because what the data showed is that lower income individuals are overwhelmingly reliant and dependent on transit. So if you are taking this revenue that you're deriving from this new congestion pricing charge and reinvesting it back into public transit, that is actually progressive policy, not regressive policy. And we were very clear to show who would be most impacted. And those who would be most impacted positively would be those individuals riding the subways, buses, and commuter rail. Because again, those are the lower income individuals, the communities of color, individuals living with a disability, older adults, younger people who, again, need our service the most. Shifting to Delaware, we are introducing a new on-demand microtransit service in Sussex County. And we looked at the data to better understand how our rural communities need better transit service. And what we know is that our rural communities do have a high concentration of low-income individuals, older adults, veterans, and people living with a disability. And we want to improve the service that we provide in a way that's both operationally efficient for a transit agency, meaning we can't put a 40-foot bus in every community when there's 3 people a day riding it. But we need to do something for those 3 people who rely on our service. So we or looking at our ridership trends on the service that we currently provide in Georgetown and Millsboro. And we're going to introduce this on-demand microtransit, again, an Uber transit-like experience for people who are currently using our services and hopefully new customers. So we had to rely and look at the data to see who we were serving, how we were serving them, how well or not well utilized our service was, in order to be able to identify some key locations to pilot this on-demand microtransit pilot. And it's going to launch in April. It's called Dart Connect. So we'll be looking to all of you to help spread the word, and to come to Georgetown and Millsboro, pull up your smartphone or dial the phone number and hop on Dart Connect to get where you need to go.
Nice little plug you put in there. Appreciate that. So another one that came through, you mentioned the quarter of connectivity earlier. Can you elaborate and clarify what exactly you mean by this for the audience?
So it's important for us to think of our transportation network beyond roads and highways. So when we want to travel in a vehicle, we can open up a map and see what interstate connects to what route, what other highway, so we're able to see those corridors of connectivity from the vantage point of a vehicle. We need to expand that and say, how can we as a transit user get from point A to point B? How can we do that by walking? How can we do that with bicycle infrastructure? And we don't really have a great picture of what that looks like in the state. So we can't really open up a map and say, oh, if I drive to this park and ride, I can then hop on this bus and then connect to this trail. We've not yet gotten there. We don't have all that intersection across modes. And it's very easy to do that again by looking at a map for a vehicle. But if you are not a car owner nor a car driver, how is it that you're going to understand how to get around? What are some key corridors of commercial activity, of recreational activity, of medical facilities that we may be able to access, and how do we get there? Is that accessible via transit? Is that accessible via other infrastructure? Can we get there with a bike share? So we need a better picture of all these areas of connectivity throughout the state. Again, just sort of thinking of a map with all these different ways of getting around on all different modes, not just from a vehicle.
So you discussed how important data is in making decisions. What is the biggest problem that you feel the data science community could help DART with right now, if any?
I think it's important for us to have the most verifiable data. So while we have some great data sources, data science and the science of analyzing numbers and the data that we have and then applying it is something that we could use better models for. Transit agencies, I think, suffer from one of two problems. They either have too much data that they don't know what to do with, or not enough data. And I think that we are somewhere in between here at Delaware Transit Corporation. We want to better understand the travel patterns of our customer base. And while we can rely on things like the CAD AVL systems and the APC counter that I talked about, it doesn't necessarily tell the story, right? It may not say what the employee shift is of a local employer. It may not talk about how people are sharing rides together and then finding other ways of getting home because they have no other connectivity. So we want to understand why people choose certain communities. Do they choose those communities because it's near a bus stop or a bus route? Do they avoid them because of that? Are they picking jobs based on access to transit? So these are some of the other elements of the story that we're missing. And we can get some of the data, but we need, I think, always help distilling, analyzing, and then projecting what that data could mean and what the implications of that data could mean.
So we're winding down. I think we'll have time for two more questions. Next one being, what are the biggest challenges when it comes to ensuring those relying on transit receive quality services, especially during a pandemic?
One of the biggest challenges is impressing the importance of transit. And that, I can't understate this enough, that there's so many individuals who know nothing about transit. In fact, when I tell many people that I work at Delaware Transit Corporation, or which operates DART First State, they look at me like, what's that? What do you do? What is DART First State? What does Delaware Transit Corporation do? Conversely, when I used to say that I was on the board of New York's MTA, everyone was like, oh my God, and everyone had a story or a complaint or an anecdote. So it was so ingrained in our lives. And because it was so ingrained in our lives in a big city, people inherently understood the value and the importance to the economy, to the environment, to people's livelihoods. But in communities where transit is not well understood, nor even experienced by the majority of people, it's seen as external. It's seen as disconnected from the overall economy. In fact, DTC is a significant employer in the state. We employ over 1,000 individuals who contribute nearly $200 million every single year to the local economy. It is an important employer for a workforce that provides generous benefits. So there's so many important benefits derived from the existence of transit. And for individuals that rely, it makes them civic participants. It makes sure that they're engaged, they're part of an inclusive society, they're not disconnected. And this is the same for our older adults. We often talk about aging in place, but how is an older adult supposed to retire the car keys if there's no other way for he or she to get around? This is the core, this is central to equitable, sustainable, inclusive environments. And when you start to talk about communities in this way, that is when you start to change minds and change practice. And then that leads to change of service. But that is one of the biggest challenges, is having people care about something that they don't experience on a day-to-day basis.
So last question here just came through. What has data shown when comparing the amount of people using Delaware Transit versus the amount of people utilizing the actual app that you discussed earlier? And have you tracked that?
So is the question about the DART Connect, do you think, Devin, the new service that we're going to launch?
I believe it's just more of how are you seeing ridership versus the people using the app itself? Yes.
Oh, okay. So our ridership is still low. We're about 42% lower than where we were pre-COVID at this time. But that is a significant improvement. Just 3 weeks ago, we were 48% below. So we're seeing our ridership rebound. In terms of how people are using our existing app, the DART Transit app, so we actually have a fair amount of downloads. So we're trying to understand our ridership base. Who has access to a smartphone? Who uses cash? Who uses all these different fare media like the 7-day pass or the 30-day pass? But what we're seeing is that we're seeing a bit of a shift, also spurred by incentives, right? For people to use our mobile app, our DART Transit app, and our DART Pass app, which allows you to pay also. Because we also provide some discounts for people, because we were trying to create a faster boarding experience and also reduce the time that the passenger was actually at the front of the bus with the operator. So, it was a part of a larger safety measure. So we were encouraging people to switch to smartphone use, etc. When we think about this new app that we're going to launch in Sussex County, we're not making assumptions that a significant amount of our ridership is going to have a smartphone, which is why this is not just a pilot for people with a smartphone. Taking equity considerations and putting them at the forefront, that's why we're also providing a dial-in phone number, because we want to make sure that if you do not have a smartphone nor a phone, a regular phone, you can still avail yourself of better transit service through this pilot.
Great. Well, thank you again. Thank you so much for joining us today and for giving us this great talk. I just want to quickly share my screen and let everyone know that we will have a few events coming up. The next being on Friday the 26th at 12 p.m. Our team on FAFSA we'll be discussing our work that's been done there and just talking about the dashboard that the team created. And then we also will be hosting another event, Meetup in March, that's going to be focused on augmented reality and virtual reality and data's effect on it. So just a few updates there, but wanted to just give you another warm welcome and thank you, Veronica. It was an amazing talk and really appreciate you joining us today.
Thank you all, and thanks to the team at Compass Red and the Data Lab for hosting us. And again,